What if I told you that some of the most common medical checkups people rush to get after the age of 70 might actually do more harm than good? That sounds shocking, right? Because we've all been taught that more testing means better health, more screenings mean longer life, and catching things early is always the smartest move. But what if that isn't always true anymore? What if, at a certain point in life, some of these routine checkups stop helping and start creating unnecessary stress, overdiagnosis, and even risky treatments you never really needed in the first place? Today, I'm going to walk you through 5 medical checkups that many doctors quietly avoid recommending after 70, and more importantly, why. This isn't about ignoring your health. It's about being smarter, more intentional, and protecting your quality of life as much as your lifespan. Because after 70, the goal isn't just to live longer, it's to live better. Let's start by understanding something most people never hear in a doctor's office. As we age, our bodies change, yes, but so does the way medicine should be applied. What made sense at 40 or 50 doesn't always apply at 70 or 80. The risks and benefits shift. Your body responds differently. And sometimes, the routine checkups designed for younger adults can lead to a cascade of unnecessary procedures, anxiety, and complications. The first checkup I'd seriously reconsider after 70 is routine cancer screening in certain cases, especially when it's done automatically, without considering your overall health and life expectancy. Now, before you panic, this doesn't mean all cancer screening is bad. It means that blanket screening without context can be misleading. Here's the reality most people don't realize. Many cancers grow so slowly that they would never cause symptoms or affect your lifespan, especially later in life. But once a test finds something, it sets off a chain reaction. More scans, biopsies, maybe even surgery or chemotherapy. And those treatments? They come with real risks, especially for older adults whose bodies may not recover as easily. Imagine going through months of stress, invasive procedures, and side effects for something that may never have impacted your life at all. That's the hidden danger of overscreening. Now let's talk about something even more common: routine full-body scans or excessive imaging tests. These are often marketed as a peace of mind checkup. People think, if I just scan everything, I'll catch anything early. But what actually happens is very different. Full-body scans often pick up what doctors call incidental findings. These are small abnormalities that are usually harmless, but look suspicious enough to trigger further testing. Suddenly, you're stuck in a cycle of follow-ups, repeat scans, and worry. And here's the problem. Each additional test increases your exposure to radiation, your stress levels, and the risk of complications from procedures that might not have been necessary in the first place. Peace of mind turns into anxiety. Prevention turns into overdiagnosis. And instead of feeling reassured, many people end up feeling more uncertain about their health than ever before. Now let's move into something that surprises a lot of people: routine cholesterol testing and aggressive treatment goals after 70. For decades, cholesterol numbers have been treated like a scoreboard. Lower is always better, right? But after 70, the relationship between cholesterol and health becomes more complex. In fact, some studies suggest that slightly higher cholesterol levels in older adults may actually be protective in certain situations. The body uses cholesterol for essential functions, including hormone production and maintaining cell integrity. What becomes risky is aggressively lowering cholesterol with medications when it may not provide the same benefits as it does for younger individuals. These medications can come with side effects, muscle pain, fatigue, even cognitive issues, that can significantly impact quality of life. So instead of blindly chasing lower numbers, a more thoughtful approach is needed. One that looks at your overall health, your energy levels, your lifestyle, and your personal risk factors, not just a lab result. Now here's another one that many people don't question: routine bone density scans done too frequently. Osteoporosis is a real concern, especially as we age, and bone density scans can be useful. But the key word here is routine. When done too often, these scans can lead to unnecessary treatments, especially when minor changes are detected that don't actually increase your risk of fractures significantly. Medications prescribed for bone health can have side effects, and not everyone needs them. Sometimes, simple lifestyle adjustments, like strength training, proper nutrition, and balance exercises, can do more to protect your bones than jumping straight into medication based on a borderline scan result. And then there's one of the most overused checkups that rarely gets questioned: routine annual physicals with a long list of tests that aren't tailored to you. The idea of a yearly checkup sounds responsible, and in many cases it is. But the problem is when it becomes a one-size-fits-all checklist rather than a personalized conversation. After 70, your health priorities are different. It's less about detecting rare diseases early and more about managing what actually affects your daily life: mobility, balance, mental clarity, energy, independence. A long list of generic tests doesn't always address those things. In fact, it can distract from them. What matters more is a focused, meaningful discussion with your doctor, talking about how you feel, what challenges you're facing, what your goals are. Because health at this stage isn't just about numbers, it's about function, comfort, and maintaining your independence. Now, I want to be very clear about something. This isn't about avoiding doctors or skipping care. It's about asking better questions. It's about understanding that more testing isn't always better testing. Every checkup should have a purpose, a clear reason, a benefit that outweighs the risk. If a test is unlikely to change your treatment, if it could lead to unnecessary procedures, if it creates more anxiety than reassurance, then it's worth pausing and asking, do I really need this? Because one of the biggest shifts that happens after 70 is this. The focus of healthcare moves from prevention at all costs to balance. Balancing risk and benefit, balancing longevity and quality of life, balancing medical intervention with natural aging. And this is where many people feel lost. They assume they need to do everything possible to stay healthy, but sometimes doing less, when done thoughtfully, is actually the smarter, safer choice. Let's talk about what you should focus on instead. Instead of chasing every possible test, focus on maintaining your strength. Muscle mass naturally declines with age, and that has a direct impact on mobility, balance, and independence. Strength training, even light resistance exercises, can make a massive difference. Focus on your balance. Falls are one of the biggest risks after 70, and they're often preventable with simple exercises that improve coordination and stability. Focus on your nutrition, not extreme diets, not restrictions, but making sure your body gets what it needs to function well. Protein, vitamins, hydration, all of these play a critical role. And most importantly, focus on how you feel day to day. Your energy levels, your sleep, your mood, your ability to move comfortably. These are the real indicators of health that no scan or blood test can fully capture. There's also something else that doesn't get talked about enough: the emotional side of overtesting. Constant checkups, frequent scans, waiting for results. It can create a sense of being sick, even when you're not. It keeps your mind in a state of worry, always waiting for the next issue to appear. But health isn't just physical, it's mental, it's emotional. And protecting your peace of mind is just as important as protecting your body. Now imagine a different approach. Instead of rushing to every possible checkup, you take a step back. You ask your doctor, what tests actually matter for me right now? You focus on what truly improves your quality of life. You simplify your healthcare instead of complicating it. That's not neglect, that's wisdom. Because the goal isn't to avoid medical care, it's to use it wisely. So if you or someone you love is over 70, this is your reminder to rethink the idea that more testing equals better health. Sometimes it doesn't. Sometimes the best decision you can make is to be selective, to be informed, to understand that your body, your life, and your health journey are unique. And the most powerful thing you can do is take an active role in those decisions. Ask questions, have conversations. Don't be afraid to say, do I really need this test? Because the answer might surprise you. And it might just save you from unnecessary stress, unnecessary procedures, and help you focus on what truly matters, living your life with strength, clarity, and peace of mind. And this is where something even more concerning starts to happen, something that doesn't get enough attention but quietly affects millions of people over the age of 70. Polypharmacy, or simply put, taking too many medications at the same time, often as a direct result of routine testing and overdiagnosis. Because here's how the cycle usually begins. You go in for a routine checkup. Maybe it's something simple, just a standard blood test or a screening you've been told to do every year. The results come back, and there's a small abnormality. Not something urgent, not something causing symptoms, just a number slightly outside the normal range. But instead of stepping back and asking whether it actually matters for you at your age, a medication gets prescribed to correct it. Now that might seem harmless at first. One pill to fix one issue. But then that medication comes with side effects. Maybe you feel a little more tired than usual. Maybe you notice some dizziness. Maybe your appetite changes or your sleep gets disrupted. So you go back to the doctor, report those symptoms. And instead of recognizing that they might be coming from the first medication, another drug gets added to manage the side effects. And just like that, the cycle continues. One test leads to one medication, which leads to side effects, which leads to another medication. And before you know it, you're taking 5, 7, even 10 different drugs every single day. This is what we call polypharmacy, and it's one of the most underestimated risks in older adults, especially after 70. Because the truth is, the human body at this stage of life processes medications very differently than it did at 30 or 40. Your liver and kidneys, which are responsible for breaking down and clearing drugs from your system, naturally slow down over time. That means medications can stay in your body longer, build up to higher levels, and increase the chances of side effects or interactions. So a dose that might be perfectly safe for a younger adult can become too much for someone older, even if it's technically considered normal. And it's not just about individual medications, it's about how they interact with each other. When you're taking multiple drugs at the same time, the risk of drug interactions rises dramatically. One medication might amplify the effect of another, making it too strong. Another might cancel out the benefit of a different drug. Some combinations can even create entirely new problems that weren't there to begin with. For example, a medication prescribed to lower blood pressure might make you feel lightheaded, especially when you stand up quickly. That increases your risk of falling. Then you might be given another medication to address dizziness or anxiety, which can further affect your balance and coordination. And suddenly, something as simple as standing up from a chair becomes a risk. Falls are one of the leading causes of injury in older adults, and polypharmacy plays a huge role in that risk. It's not just the aging process, it's the medications, and more importantly, the combinations of medications that can affect your brain, your reflexes, your balance, and your awareness. Now think about how this all started. It often begins with routine testing that identifies something minor, something that may never have caused a real problem in your life. But once it's labeled as an issue, it's treated as something that must be fixed, and that's where the chain reaction begins. Another important point that many people don't realize is that not all medications are equally beneficial at every stage of life. Some drugs are prescribed based on long-term benefits that may take years or even decades to show results. But after 70, especially if you're dealing with multiple health conditions, the focus often shifts more toward immediate quality of life rather than long-term prevention. So, if a medication is unlikely to provide a meaningful benefit within your expected lifespan, but still carries risks and side effects, it may not be the best choice for you. This is where thoughtful decision-making becomes so important. Instead of automatically adding another medication based on a test result, it's worth asking a simple but powerful question. What difference will this make in my day-to-day life? Will it help you feel better, move better, think more clearly, sleep more peacefully? Or is it simply correcting a number on a lab report without actually improving how you feel? Because at this stage of life, how you feel matters more than any number on a piece of paper. There's also the issue of what we call prescribing cascades. And this is something that happens far more often than people realize. A prescribing cascade occurs when a side effect of a medication is mistaken for a new medical condition, leading to the prescription of another drug to treat that side effect. For example, a medication might cause swelling in the ankles, which could be misinterpreted as a heart or circulation problem. So another medication is added to reduce the swelling, which then affects your electrolyte balance, which then leads to yet another medication. And each step in that cascade moves you further away from the original problem and deeper into a complex web of treatments that may not have been necessary in the first place. Over time, this can become overwhelming, not just physically, but mentally and emotionally as well. Managing multiple medications can be confusing. Different doses, different schedules, different instructions. Some need to be taken with food, others on an empty stomach, some in the morning, some at night. It becomes a full-time responsibility just to keep track of everything. And with that complexity comes a higher risk of mistakes. Missing doses, taking the wrong combination, or accidentally doubling up on medications can all have serious consequences. Another factor that often gets overlooked is how medications can affect cognitive function. Certain drugs, especially when combined, can impact memory, concentration, and overall mental clarity. You might feel more forgetful, more confused, less sharp than you used to be. And it's easy to assume that this is just a normal part of aging. But in many cases, it's not aging. It's the medications. Reducing or adjusting medications under proper medical supervision can sometimes lead to noticeable improvements in mental clarity and overall well-being. Now here's something that might surprise you. Studies have shown that in many cases, reducing the number of medications in older adults can actually improve health outcomes rather than worsen them. This process is called deprescribing, and it's exactly what it sounds like: carefully reviewing and reducing medications that are no longer necessary or beneficial. But the challenge is that deprescribing doesn't happen automatically. It requires awareness, communication, and a willingness to question whether every medication is still needed. Because once a medication is started, it often continues indefinitely, even if the original reason for prescribing it is no longer relevant. This is why regular medication reviews are so important, especially after routine testing leads to new prescriptions. Instead of simply adding more, it's about stepping back and asking, do I still need everything I'm taking right now? Are there medications that can be reduced, adjusted, or even stopped safely? And this isn't something you should do on your own, but it's absolutely something you should discuss with your doctor. A good healthcare provider will welcome that conversation, because the goal isn't to prescribe more, it's to help you live better. There's also an important emotional aspect to this that often goes unspoken. Taking multiple medications every day can create a sense of dependency, a feeling that your health is entirely controlled by pills, rather than your own actions or lifestyle. And while medications can absolutely be necessary and life-saving in many cases, relying on them unnecessarily can take away from the confidence and empowerment that comes from taking care of your body in other ways. Simple lifestyle changes, like staying active, eating well, maintaining social connections, and getting enough rest, can often have a powerful impact on your health without the risks that come with additional medications. But these approaches don't always get the same attention because they don't come in a prescription bottle. So the next time a routine test leads to a new medication, it's worth pausing for a moment, not rejecting it outright, but asking the right questions. What is this medication for? What benefit can I realistically expect from it? What are the potential side effects? How might it interact with the medications I'm already taking? And most importantly, is this truly necessary for me right now? Because after 70, healthcare isn't just about adding more. It's about choosing wisely. It's about understanding that every medication comes with both benefits and risks, and those risks increase as the number of medications increases. And it's about recognizing that sometimes the best way to protect your health isn't by adding another pill, but by simplifying your approach and focusing on what truly matters for your quality of life. And this brings us to something even more subtle, but incredibly important to understand: the hidden risks of false positives and how they quietly lead so many older adults into treatments they never actually needed. Because on the surface, getting a positive result from a test sounds like a good thing. It feels like you've caught a problem early, like you're being proactive, like you're staying ahead of your health. But what most people don't realize is that not every positive result means there is a real, dangerous disease present. Sometimes, it simply means the test was wrong. This is what we call a false positive, and it happens far more often than people think, especially when routine screenings are done in populations where the likelihood of disease is lower, or when testing is done too frequently without a clear reason. And after the age of 70, the chances of encountering false positives increase, not because your body is failing, but because natural changes in the body can make test results look abnormal, even when they are not harmful. Let's break this down in a way that really makes sense. Every medical test has limitations. No test is perfect. Even the most advanced scans and blood tests have a margin of error. They are designed to detect patterns, markers, or abnormalities, but they cannot always distinguish between something that is dangerous and something that is simply a normal variation of aging. So what happens is this: your test flags something as abnormal, even though it may never cause symptoms, never progress, and never affect your life in any meaningful way. But once that result appears, it changes everything. Because now it's no longer just a number or an image. It becomes a concern that needs to be investigated. And this is where the cascade begins. One test leads to another. A scan leads to a more detailed scan. A blood test leads to a biopsy. Each step designed to get more clarity, but each step also bringing its own risks. And here's the part that most people don't expect. Those follow-up tests are often more invasive, more stressful, and more dangerous than the original screening. A biopsy, for example, might sound routine, but it involves removing tissue from the body, which carries risks of bleeding, infection, and complications, especially in older adults whose bodies don't heal as quickly. Advanced imaging tests can expose you to higher levels of radiation or require contrast dyes that can affect kidney function. And all of this is happening not because you were feeling unwell, but because a test suggested something might be wrong. That uncertainty is one of the most difficult parts of false positives, because you're suddenly living in a space between maybe something is wrong and we're not sure yet. And that space can last for weeks or even months as more tests are done. It creates anxiety, stress, and a constant sense of waiting for results, waiting for answers, waiting for the next appointment. And during that time, it's easy to feel like your health is fragile, like something serious is just around the corner. But in many cases, nothing serious is actually there. Now let's talk about something even deeper, the concept of overdiagnosis. This is closely linked to false positives, but it goes a step further. Overdiagnosis happens when a test correctly identifies an abnormality, but that abnormality would never have caused harm during your lifetime. In other words, it's real, but it's not dangerous. And yet, once it's found, it's very hard to ignore, because both patients and doctors feel compelled to act. It feels risky to do nothing, even when doing nothing might actually be the safest choice. So treatment begins, and this is where the real impact shows up. Treatments, especially for conditions like cancer, can be aggressive. Surgery, radiation, medications, all of these come with side effects that can significantly affect your quality of life. Fatigue, pain, weakness, changes in appetite, reduced mobility. These are not small things. They can change how you live day to day, how independent you feel, how much energy you have to enjoy your life. And when those treatments are being used to address something that may never have caused harm, the balance between benefit and risk becomes very unclear. You might go through all of that without actually gaining any real advantage in terms of longevity or health. Now imagine this scenario. Someone goes in for a routine screening, feels perfectly fine, and is living an active, independent life. A test comes back positive for something suspicious. That leads to more tests, which confirm an abnormality. Treatment is recommended, and they go through with it, believing it's the right decision. Months later, they're dealing with side effects, reduced energy, maybe even complications from the treatment itself. And all of this started from a test that may not have been necessary in the first place. This is not about blaming doctors or saying that tests are bad. It's about understanding that every test has consequences, not just physical, but emotional and psychological as well. Because once a result is labeled as abnormal, it's very hard to go back to a place of feeling completely healthy. Even if further testing shows that everything is fine, that initial result can stay in the back of your mind. It can change how you see your body, how you interpret sensations, how you respond to minor symptoms. You might become more alert, more cautious, sometimes even more anxious about your health. And that mental shift is something that doesn't get talked about enough. Now, there's another layer to this that's especially relevant after 70. As we age, the likelihood of having small abnormalities in the body increases. Tiny nodules, minor changes in blood markers, slight irregularities in imaging. These are often part of normal aging. But when we apply the same testing standards used for younger adults, these normal changes can be flagged as potential problems. And that increases the chance of false positives. So it's not just about the test itself. It's about whether the test is appropriate for your age, your health status, and your individual situation. Because a test that is helpful at 40 might not provide the same value at 70, and in some cases, it might create more problems than it solves. This is why context matters so much. Before doing any test, it's important to ask, what is the likelihood that this test will find something meaningful? And if it does find something, what will we do with that information? Will it lead to a treatment that actually improves your quality of life? Or will it start a chain of events that brings more stress and risk without clear benefit? These are not easy questions, but they are important ones. And they highlight a shift that needs to happen in how we think about health as we age. It's not just about finding everything that could possibly be wrong. It's about focusing on what truly matters for your well-being. Because the goal isn't to eliminate every abnormality. It's to maintain a life that feels full, active, and meaningful. And sometimes, that means accepting that not every finding needs to be chased. Not every abnormality needs to be treated. It means understanding that the body is not a machine that needs to be perfectly calibrated at all times. It's a living system that changes over time, and not all changes are harmful. So the next time a test is recommended, especially if it's part of a routine screening, take a moment to pause. Ask what the chances are of a false positive. Ask what the next steps would be if something is found. Ask how it would impact your life, not just your medical record. Because being informed doesn't mean avoiding care. It means choosing care that aligns with your needs, your values, and your goals. And it means recognizing that sometimes the biggest risk isn't missing a disease. It's finding something that was never going to harm you and going down a path of treatment that changes your life in ways you never expected.